Okay, hi everyone. Seems like a while since we've been together, but time does fly here, another 2 weeks. So let me start you off with the briefing like we normally do on the cases. And we're obviously seeing, much like every other surrounding jurisdiction, the case rates increase. For example, on Sunday we had plus 55. On Monday we had 121 new cases. And on Tuesday we've had 105 new cases. We have not seen these numbers in a while. Unfortunately, I report that we've had 3 new deaths since we last spoke, and our total cases have now reached 12,780. The R-naught is still relatively good at 1.03, but it's the category that continues to amaze me that 20 through 49 just continues to rise, and that's where we're seeing more of the gatherings and more of the infection. Conversely, it's nice to see that our more senior population, the numbers have somewhat stabilized, not only in deaths, but really on the infection itself rate that is somewhat stabilized. It's clearly a disproportionate amount of infections are still occurring in the Latino and Hispanic population, with just about more than half of those infected being from that category. As we go to the next slide, Miles, the good news is, even though with these infections, but there's a lag time, and that's what we're worried about. There's only 27 confirmed hospitalizations for COVID-19 right now. That is good. We have a lot of capacity. We have a lot of room available for others. We hope we never have to use it, obviously, but the good news is we do have that room. We've now tested almost 237,000, just short of 237,000. So that is an incredible number, and you can see where the cases are. And again, the long-term care facility data has somewhat stabilized because of the work being done there. I got to tell you, on the testing front, we have never seen numbers like we're seeing right now. Yesterday was an all-time high of just over 2,500 tested from the 2 county sites at the event center and at the San Bruno site yesterday, over 25, and it looks like today is going to be another banner day. But the nice thing is that I'm hearing is that it's very smooth. People are getting in. It's very quick, and it's very well organized, which is terrific. I've heard nothing but great feedback on the curative family line. This is, again, families that can bring their kids through that line. I got just a great email the other day talking about how easy it was to get the whole family tested, because one of the schools had suggested that families get tested through that line, and it was very easy for them to do it. And we are suggesting people do get tested. Remember, you can go through your own provider to do that, or certainly we have our event center or our mobile testing that we move around the county, and we're even doing more of that now. With the other information on testing that's just amazing is how far we've come in such a short period of time. We are now over 500 tests per 100,000. If you had told me that 6 weeks ago, I would have said there's absolutely no way that we could do that. But there are it's been a over 100% increase. We're seeing that in our lines, and certainly other of our partners in health. Some of the other providers out there are stepping up testing too, and we're seeing the results of that as a county community. We have increased the ability to get in and out of the event center, so it is running very smoothly out there. And certainly we see an increase because of the surge that people are hearing about, but also because people are wanting to know if they're positive before potentially visiting family members for Thanksgiving. And we're discouraging that this year. We want to make sure that people understand that that test is a snapshot in time, and what it means is that you are not positive as of you driving through that line and getting tested. later on that day, later on that week, you certainly could have been infected, and you could still have COVID-19. So that's why we're discouraging it. It's certainly good for us to know who's positive, because it allows us to conduct all the contact tracing so we can try to get out in front of this and warn people to shelter, to not expose others. So that is a great benefit, but please do not, think of this as an indication that you are okay to gather in groups because you tested negative. So on the blueprint for a safer economy, you've all heard, unfortunately, after all the work we put in as far as the time and the expense and the sacrifices to get to orange, we have now reverted back to red overnight. And that is how things will go into the future. There will be no more spending a sustained period of time in an area before you move back. You could move back immediately, and we could be moving back to purple at any moment in time here. But just to give you some of the numbers, just to give you an idea, so this is per 100,000. The 11/16 numbers were 5.7 on the adjusted case rate, 5.7. Just a week prior to that, on the 11/9, and all these times are lagging times too, dates are lagging, was 2.2. So we went from 2.2 to 5.7 adjusted overnight. So that means on the unadjusted, on 11/9, we were at 4.1, and we went to 10.4 within a week. We doubled those positive cases in a week. The positivity rate went from 1.3 to 2.1, still pretty good, but 2.1. And the interesting thing is, and kind of the silver lining here is on the health equity metric, we stayed at 2.5. So that is indeed good news. And as our Chief of Health, Louise Rogers, reported to the board yesterday, the county's newest unadjusted case rate has more than doubled, like we just indicated. We are very similar to other Bay Area counties in this rollback. Obviously, we're one of the few, not only in the Bay Area, but the state to stay in red. But, this is disconcerting, but the difference now is we're more prepared for this surge than we were early on. There are better policies, procedures, protocols in place. There's PPE in place. We've got our contact tracers in place. We've got lots of testing in place. So we're in a far better space now than we were when we saw the first wave of surges, even the second wave of COVID-19. So Miles, if you can bring up the red infographic here, just some changes. You notice that wineries are allowed to operate outdoors. State has also issued a travel advisory regarding face coverings, that mandate face coverings be worn times outside the home, prevent the spread. The advisory is not recommending you travel out of the state or people come in from outside the state. And for the holidays, the simple message is do not gather. Do not gather. Do not assume a negative test is going to protect you with your loved ones. And the message is being amplified. Michelle's doing a good job of getting this out. Michelle, did you come up with this? Do gobble, don't gather?
I think Krista gets the credit.
Okay, Krista gets the credit, but it's kind of catchy. Do gather, don't gobble. Or no, don't gather, do gobble. Yes. So we'll get that down. But it means really safe means outdoors, small, no more than 3 households, short 2 hours or less, and stable, avoid participating in multiple events. So safe, small, short, and stable. And while certainly disappointing, the uptake here, we are responding accordingly. And again, our hospitalization rate is certainly under control at this point, and we've got lots of capacity. So I'll give you an update on the cases assigned out, just to give you an idea of what the contact tracers are doing. Health assigned out 662 cases, which even of itself was a 36% increase the week of October 25th, the week of October 25th. So Through November 12th, County Health has referred 941 persons through the contact tracers. And the other ones, and these are ones that went through the Mental Health Association Public Health Support Program. So this is the program that allows for isolation, hotel rooms. We've really seen an uptick in those who need assistance in isolating in a hotel, or with help with groceries, or help with income as they try to isolate and keep others safe when they catch COVID-19. So we're seeing an uptick in that, but we are well resourced there and able to meet that demand. Also, the county health focused on working with the state for the rollout of the new vaccine. I know there's a lot of questions from the media on that, and we'll talk just a little bit about that when we get to the end of this. A couple other updates on the COVID-19 compliance team. First, on the engagement team. This is the team that goes out and really works with the businesses. They have visited 156 businesses, 92 which were English, 64 were Spanish-speaking business owners. On average, the team spends about 20 minutes with each business to really talk about with them how to make the business safe, what they can do to enhance safety for their customers. The compliance team also goes out there and educates businesses, but they also have the ability to cite and issue warning letters. And they have so far had almost 400 complaints, 392 complaints. 276 of those have been abated, meaning the violation was either not found or was corrected on the spot. And other cases are in progress of either being further investigated or referred. So they are out there, and they're well received. I can tell you the compliance unit really is focusing on restaurants and gyms and places where they have a lot of high contact to make sure that there is, in fact, space, ample space being utilized, and that they're adhering to the occupancy requirements now of red, which is 25%, in gyms going back to 10%. So these are things that they're out there doing on a daily basis, and they're really well received. Most of the complaints they're all over the county, but in the bigger cities, as you can imagine, is where we're getting most of the complaints. And the most common grievance that we're seeing is they're not wearing face coverings, they do not have the required signage posted, or they are not taking steps to socially distance. So that's what we're up against. Update on recent board actions: 1 million additional CARES Act fund for small business assistance, 1 million in unused CARES Act funds for food assistance, 998K in additional CARES Act funds for nonprofit grants, 2 million additional CARES Act funds for the Child Care Relief Fund, and 500K in CARES Act funds for rent assistance. So all of you probably heard already the emergency regulation to cap fees charged by food delivery services. New regulation prohibits fees charged to restaurants that exceed 15% for delivery orders and 10% for pickups. The Great Plates program, unbelievable. 950,000 meals to date have gone out to those in real need, with over 3,100 participants in that program now. 69 active restaurants, and that program has been extended through December 8th, 2020, which is good news. And we would therefore extend it through the end of the year if we had to make sure that no one was left just with a sudden stoppage of food. San Mateo County Immigrant Relief Fund, Miles, I think you have that perfect. Received 23,000 pre-applications, 12,000 plus applications started. Awarded a total of 10,730 grants of $1,000. The program's progress meter shows that the fund is 84% expended, and the fund is a total of $12,365,000 to distribute, which includes $4 million in Measure K funding. The Mass Mobile, very active last week. 391 masks and over almost 14,000 masks distributed to date. I think we have where it will be. There you go. Monday, Tuesday, Wednesday next week. They are out and about. So submitted media questions. A lot have to do with the vaccine. And yes, we are very fortunate that there are 2 very promising vaccines out there. The questions is, how many doses do officials plan or believe the county will receive? And what are plans for storage? And what will the order of priority be for receiving the vaccine in San Mateo County? And I'll let Sheree just take this, but I think I just want to say that, health has been working on a plan for a while in regard to vaccinations. We always start with the end in mind, and this pandemic will end with a vaccine, and it's on the horizon now, and that gives us all great hope. But as we wait for that, we've got to be diligent. We can't let our guard down here. I would assume that the vaccine would start with our essential workers in the health field. But Sarija, do you have more information on that?
Yeah, thanks, Mike. And I do want to reinforce what Mike just said about we're not there yet. So this isn't a time to get so excited about the vaccine that we forget about the core precautions we have to keep taking until we get to these timelines. We've been actively engaged and closely monitoring with the state and understand that the first distribution of vaccines to local communities will likely be in late December. The prioritization and which populations get first access doesn't get decided until the vaccines, Pfizer and Moderna, receive that emergency use authorization to which they've applied. And once that is authorized, then the national body that delineates the prioritization makes their decision. We expect that first population to be healthcare workers who are in contact with patients with COVID-19, are those at highest risk of exposure. And we don't know the timeline for distribution beyond that early December 1st distribution. Dr. Fauci said in the national media that he's hopeful, but that by the second quarter of 2021, there could be some dissemination to the general public. We also understand that Pfizer and Moderna are within a couple weeks of each other in terms of their own timelines. So a lot of this has to do with not only getting the approvals, but then the manufacturing and the distribution and the supply issues that go with each one.
Sarija, there's a question about what do we do with members of the public who are apprehensive about getting a vaccine? What would you tell them?
Yeah, I mean, first of all, the data that came out is really encouraging about safety and efficacy. So we do hope as people learn about the rigorous standards to which these vaccines are being held and no shortcuts on safety and efficacy, that some of the anxiety and concerns might abate. But we also expect to need to enlist trusted messengers in reinforcing what we understand about the safety and efficacy. We don't want to get ahead of ourselves in getting feedback and involvement of folks in disseminating the messaging until we know when the public can expect to get the vaccine. And we'll appreciate the media's partnership as well. There are populations that have wariness, and we want to make sure that this is a vaccine that gets to everybody so we can all protect ourselves and each other.
Great, thank you. Next question I have from the media is in regard to CARES Act funding. I can tell you that it is expected to all be spent by the end of the year in compliance with the CARES Act. And it's not only on the great grants that have been given out, the numerous grants we talked about here to very, very worthwhile causes, but on PPE and health and hotels and the Great Plates and all the other things that we have utilized that funding for, but it will be expended. At least that's our goal, to expend it by the end of the year. Next question, now that the county is back in red and potentially going into the purple, are officials considered replenishing any emergency fund programs like small business grants and renter assistance? So we just did that. We just, at the latest board meeting, or I'm sorry, the board meeting before that, we just added funding to those in particular, as well as childcare and other areas of importance. as we get through the end of the year. But our great hope is that the HEROES Act will come to fruition in 2021 or sooner, because there is so much need out there, so much need, especially as we take a step back and more people are being laid off as businesses close or reduce operations. There is incredible need, so we're really looking forward to relief from the federal government. And we hope that comes soon, but I can tell you it can't come soon enough. And then going into the holidays, some may be planning to get tested for the virus a couple of days before. We talked about that. It's meaningless if you're planning to use that testing as an opportunity to meet with family members and say that, I got tested, I'm not sick. It's just a fallacy. It's something that you cannot rely on and something you should not rely on. This is a different year for us. We've got to be vigilant. We've got to make sacrifices. We're almost there. I know people are tired of hearing this. I think we're all tired of it, but it's something that we just got to do unless we want to see more people get ill. So, Sari, do you have anything to add to that?
No, and we have so many ways to show our family we love them. Let's keep each other safe. And we just have to double down, as Mike said, to get through this tough period.
Good news is the light is at the end of the tunnel, and we're all getting there together in the community. I'm just so proud of San Mateo County, how it's come together, where we, getting to the orange together. This is a setback, but it's all about keeping people safe. Miles, any questions?
Yes, we have one question from Henrietta Burrows.
Henrietta, how are you?
I am fine, thank you, Mike. I hope you are too.
Great.
I have two questions. One, do you have any idea where most of the surge in COVID cases is coming from? Is it private gatherings, restaurants, gyms?
Well, we're not seeing it from any particular business. We believe it's from the social gatherings. I don't think we have any data to suggest that we're seeing a surge because of restaurants or gyms or anything else. There's a potential there, obviously, because there's a lot of people that frequent them. But we're not seeing that. And Sarija, do you have more information?
Yeah, and it's actually really consistent with colleagues in the Bay Area and across the state that gatherings continue to be a significant source. We also see it across all racial ethnic groups, and especially the Latino, Latinx population. We see it in the younger age group, that 20 to 39 age group. So it is a time to really take heed. Pandemic fatigue appears to be real, but we need to find the resolve to get through these tough weeks.
I think that we somewhat benefited from our climate here in that, we usually have very nice weather through October as we did this year. And now as the weather gets colder and the rainy season comes, people, who were maybe gathering outdoor, maybe not the safest, but maybe better, are now indoors gathering. And that adds a lot of concern to the surge here and what could happen, especially with the holidays.
Second question, there are apps that notify people that they have been exposed to the virus. Are you familiar with any of those? And would any of them be recommended?
That's Sarija.
Yeah, so the largest one actually has a pilot with the state of California. It's a state pilot, not a local one. And it involves Google and Apple. And they started with 2 UC campuses. I believe it was UC San Diego and UCSF, and then they expanded to several other UCs just a bit earlier this month, I believe. So we're watching that to see how that goes and learn from the experience on the campuses.
Do you know where people can get information about them?
There is a little bit of information on the California Department of Public Health website. I could provide that to Michelle, Henrietta, to get to you.
Thank you so much.
Okay, any other questions?
Yes, we've got Sarah Wright, then Astrid Casimir.
Sarah, how are you?
Good, how are you? Thanks for your time.
Sure.
I have a couple of disconnected questions, so bear with me. The first one is in regard to the vaccine. This is for Srija. have a question about if and when the vaccine is distributed to the general public. What's your idea of how other safety protocols will begin to be phased out? Do you foresee it as a situation where, you know, mask wearing and social distancing will still be, in place even while all of this is being rolled out?
Hi, Sarah. Yes, the public health professionals expect us to be in an environment of continuing to have these precautions in place for many months, you know, through next fall even. The two vaccines that we've been hearing about, the Pfizer and Moderna, they're each a 2-dose vaccine that I believe it's 21 days in between the doses. So it isn't a situation where as soon as vaccine starts to get distributed, everything else can revert back to the pre-pandemic days. We're going to have to get to a period of almost everyone actually getting those 2 doses if it's the 2-dose dissemination.
Got it. Thank you. And can you give me numbers on how many, I know you talked about testing earlier, but how many tests in raw numbers has the county been doing each week on average? Do you have those numbers?
I don't have on
Or
average, but do you have them? Do you have that?
We could certainly get them to you.
Okay.
I mean, you know, we had a 2,000 day this week and another in the 1,500s. So we could certainly get that to you.
Okay, thank you.
And overall, from the weekly data, we are doing about 3,900 tests per day as a county. You know, this is all the tests, private healthcare providers, as well as our community testing sites. And then the county's community sites and the supported sites are a subset of that total.
Sarah, I can tell you, so last week, we did 9,828 tests from the county sites. So that's the event center, the mobile sites, and the curative drive-through.
Got it.
So 9,828.
Got it. Thank you. And then I had put this request in through the media line a couple times, and I just wanted to ask sort of what the barrier is here. But I've been trying to get test results, so case rates, I suppose, over time by city. So on the dashboard, we have, for example, stagnant numbers for Half Moon Bay or for Pescadero. But is there any way to get, you know, those case numbers over with the time metric, whether it's daily or weekly? And if not, sort of what's the issue there?
That's the first I'm hearing about it. So
Yeah, I'm sorry if there was a barrier in getting back to you, Sarah, in a timely way, but we update the data that feeds the dashboard and the map that shows the rate weekly. And really what we're trying to balance is the capacity of the epidemiology team,
Right.
whose you know, expertise is needed for so much of what we're trying to learn to mitigate the virus. So that's what we're trying to balance.
Got it. That makes sense. I was just wondering if there was some, you know, HIPAA reason or otherwise.
sounds like just
Sorry. Okay. One more question.
Yeah, no problem.
Okay. Got it. The last question I have, sorry, this is coast side specific, but I know you guys are working with Project Home Key to purchase hotels in the county. Are any hotels on the coast side being considered right now for that program?
Yes, there's 2 on the coast side being considered right now. There is a special meeting tomorrow, I believe, of the Half Moon Bay City Council, and we'll be discussing that.
Great. Thank you. That's all I have.
And there's 2 more hands raised, and I think that would be it. So we have Astrid and Sierra. So Astrid?
And Astrid,
Hi, Suja. Question about, and I apologize if you did answer this already, my internet kind of cut off. But I'm wondering how many people have been cited, like how many individuals do you know have been cited for like not wearing a mask in public or not doing social distancing?
I'm not sure about individuals being cited. I know that a business has been cited, and I can't recall which one, but it's just recent.
The yoga studio.
Yeah, that's right.
Okay, got it. So is it that you don't know, or is it like to your knowledge, like are people I guess, are people being warned even if they're
Oh.
being seen in public without wearing a mask, for example?
Yeah, I would
that they're
imagine,
not being enforced?
I mean, I can't speak to that for sure, but I would imagine that, you know, there have been warnings, but I don't really think there's been anyone cited for not
Okay.
wearing a mask. At least, I'm sure I would have heard about that.
Okay, thank you.
You're welcome.
Great. And Sierra?
Yeah, hi. How's it going?
Good, Sarah. How are you doing?
I'm doing good, thank you. I wanted to clarify on the vaccine doses. I know that, you know, we're still early on, but Surya, you mentioned December 1st, there'd be a distribution for medical professionals. Is that
Late
here in
December is what we're hearing, Sierra, just to make sure I wasn't misheard or misspoke.
I'm sorry, one more time, late when?
Late December, not December 1st.
Late December. So then that would be medical professionals here in San Mateo County?
Correct. The distribution pathway that would come to us would include vaccinating people who are in the healthcare field, who are in that first priority population. There's also a pathway in which healthcare providers that serve multiple counties, a Sutter or a Kaiser, will have a direct route to receive vaccine doses for those professionals.
Do we have an idea or an estimate of how many doses that would be?
We really don't yet. There is a plan, and that the state is pulling together in December to help validate numbers and surveying and estimates. We've been doing a lot of outreach to try to quantify different populations, how many fall into which groups.
Okay, thank you so much. I appreciate it.
Absolutely. Anything else? All right, listen, I wish all of you a very, very happy and safe Thanksgiving. Thanks for all you're doing out there and reporting the news. And we hope to see you back in, I think it'll be December 2nd will be the next briefing. You all take care. Bye-bye.